The Kovai Post, news delivered.
Hello and welcome to this edition of Kovai Post. I am Dr. Karthik, orthopedic surgeon working in Global and Ortho Hospital in Ramnagar, Coimbatore, South India. Today we're going to see about muscle cramps, especially the nocturnal muscle cramps, where people complain of pain in their calf muscles during the night, especially when they're about to fall asleep or during the day. In the beginning of the morning, early hours, they complain of this pain. Spasm is a condition where the muscles of the calf is tighter and goes stiff and causes an uneasiness and a pain in that region. There's a lot of factors for these, and most of the time the actual cause might not be known. And for the other reasons, the most of the time it is deficiency of certain minerals like calcium and magnesium, and deficiency of vitamins like vitamin E and vitamin D. Sometimes salts can be less due to dehydration, is all some causes associated with this. And there are other reasons because of taking certain tablets which to reduce cholesterol, or steroid tablets or antidepressants. All these tablets can cause similar problems. And some medical conditions, where there is thyroid problems or reduced circulation of blood flow in the legs, peripheral blood diseases, and sometimes even in pregnancy, late stages of pregnancy can cause these muscle cramps. Most of the time, these muscle cramps are self-limiting and they get better on their own. But if they keep giving you an annoyingly painful time while you're asleep, the basic things is to stretch your calf muscles or have a hot bath. Sometimes people would love like to have ice placed on these calf muscles, which would help them. But most of the time, stretching and some kind of exercise, at least 20 minutes a day, if people do some kind of an exercise either before going to bed or first thing in the morning to help their circulation and correct the other causes, as I said, is all that is required. And once these stretching exercises, all these things is done, most of the time patients feel better. And even after these, if they still seem to have, then they can approach a doctor to find out why this is happening. There are a variety of reasons for that. There's a few tests to be undergone, and if it keeps disturbing them annoyingly for over periods of time, or if it keeps coming back on and on, the things is we'll have to find out a reason for that so that it doesn't happen again. Now what we're going to do is some of the basic stretches that's done for calf pain. Usually the pain is in this region in people. Most of the time it might be even school children who come with pain, while it might be growing pains, and it might be deficiency of calcium when growing up, or it might just be some cramps that need some stretching, more stretching. And one of the stretches, Panama, please do it. So the way you do it is you stand against a wall or something, put your hand, support yourself. The front knee has to be bent and the back knee has to be kept straight without bending at your knee, and keep moving forward, come backwards, and keep moving forward again and backwards. So you do the stretching as much as possible and as far as possible, and then change your knees, legs together, and then again do it. So you interchange the legs and gradually pull it, bit more. So do not lift your heel off the floor, and keep your knee straight and just keep stretching. These are some of the few simple stretches. Now the other exercise you do is take a rolled up towel like this, put it under your knee, and what you do is just get your foot forward a bit, push your knees down against the rolled up towel, hold it there for 5 seconds, 1, 2, 3, 4, 5, and then relax your knee up, and then push it again down, hold it up again for 5 seconds, and then relax it. And once you finish it this side, do the other side as well. Now this is the other way of doing little pressings around your knee joints so that it helps you release your stress. Sometimes smoking habits may cause these problems. So if you think one of the tablets you're taking is the reason for that, stop that and contact your doctor immediately. And please do not diagnose this by yourself. And just start with stretches if you think you have this problem, but always contact your doctor to find out the real reason for these cramps and then be treated. Thank you.